morning. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Dr. Junda Wu, our public health authority here in San Antonio. We're also joined by a very special guest, singer, songwriter, Grammy Award winner, and COVID survivor, Little Joe. Little Joe was part of the city's What Will It Take campaign, which brought awareness and educational information to our San Antonio residents. He wrote a song that encourages the public to take precautions and to get vaccinated. The song's been featured on local television and radio programs. I think you saw it here a few weeks ago, and we're glad to be joined by Little Joe. He's going to have a few words in just a moment. But first, very quickly, today's weekly vaccination report shows that 930,358 individuals in Bexar County have received at least one dose of the COVID-19 vaccine. 692,474 people are fully vaccinated. That means that 61.8% of our population has had at least one dose, and 46% of the eligible population is fully vaccinated. We continue to exceed both state and national averages. And again, you do not need an appointment anymore. You can just show up. As a reminder, people ages 16 and up can now go to the Alamo Dome on a walk-in basis from 9 a.m. to 6:30 p.m. to receive the COVID-19 vaccine without an appointment. If you do prefer to book an appointment, they are available by calling 311 or by going online. Remember that you can receive text alerts for when appointments become available by texting vaccine or vacuna to 55000. Let me turn it now to Judge Wolff.
Well, thanks, Mayor. And as you know, today the FDA approved the use of vaccines for 12 to 15-year-old. My grandson, Ben Winland, had asked me about that last week. Sure enough, he was right on here asking me today, can he get his shot? And I said, well, I think in a couple of days or so, they'll be available, I believe. And so he can help us get to herd immunity because about 20% of our population in the United States are children. And if we want to hit that 70 or 80 or whatever it is on herd immunity, these young people vaccinated. We did about we're done about 420,000 vaccinations now through our hospital system. We did 20,000 last week, but only 3,000 of those were first dose. So we still need more people to come out and get their vaccinations. Little Joe's with us tonight. I had the honor, I guess it was New Year's before last, of being on the stage with him and dancing with Erica, your wife, as he sang. So we're delighted to have him on the show with us tonight.
Thank you, sir. Thank you, Judge.
Well, Joe, tell us a little bit about you survived COVID, and now you've helped our city quite a bit in encouraging folks to get vaccines, get vaccinated, their families. Tell us a little bit about your experience.
Well, let me thank you for having me here today and congratulate you and your staff in the city of San Antonio for doing such a great job in having the numbers that you have today. But it was quite an experience. My niece, my daughter, my wife, and I, all four of us were quarantined at the same time. For those of you that have not had COVID, it is a deadly virus. It's contagious, peligrosa. So if you haven't been vaccinated y tienen la oportunidad de vaccinarse, por favor, háganlo. La vacuna is going to save your life. You know, people say that they don't want to get vaccinated because side effects, that may be the case for 2-3 days of side effects, but the vaccine won't kill you. The virus will. It's an incredible, awful, awful experience. I'm about 10% still not well. I'm operating at 90%. Having to sing, I have to kind of train my voice all over to know where to take my breaths and that kind of thing. So that and I'm still not able to focus like I did before. It's going to take a little time, but gracias a Dios, I survived it. My family survived it. So, la gente que está esperando, no sé qué esperan porque se tienen que vacunar ahorita mismo. It's not only for yourself. You got to think about those you love, your family, your friends, people around you. There's a lot of rumors, fake rumors, and you need to get the truth, the facts, and you need to get vaccinated. As I said, not just for yourself, but for your family and your loved ones. It's, again, it's just an incredible, deadly virus. And now with the new variant, it's even worse. So les pido que por favor, tienen la oportunidad de tomar la vacuna, háganlo pronto, porque necesitamos que no nomás la ciudad de San Antonio, pero todas las personas de esta ciudad se tienen que vacunar para tener una mejor salud for the whole family of San Antonio.
Thank you so much, Joe, for sharing your experience. And as you saw, Joe provided us a video while he was struggling with COVID, and now has come back full circle and is helping us with getting the message out for folks to get vaccinated. So thank you very much for being with us, Joe. And he's also here to answer questions at the end. I do want to provide you an update on our COVID numbers tonight. We're reporting 108 new cases of COVID-19, which brings the total number to 219,929. Our 7-day rolling average has dipped again to 184. Our positivity rate, which has been a great sign of where this infection has been over the last couple of months, has remained low. It's now 1.7%, and indicators continue to remain steady. Unfortunately, we do have one new death to report tonight. Please always keep those who have lost loved ones in your prayers. We have lost too many of our friends and neighbors and loved ones to coronavirus over the last year. There are 206 people in the local hospitals tonight with COVID-19, 25 new admissions over the last 24 hours, 69 patients are in ICU, and 30 are on ventilators. Dr. Wu is with us to answer, again, one of our frequently asked questions, so I'm going to pose this one to Dr. Wu. The question that we have been getting is, will I be asked for my personal information, things like immigration status, to sign up for the COVID-19 vaccine?
Your immigration status will not be asked because you do not have to be a citizen to receive the vaccine. No necesita compartir no necesita ser ciudadana o ciudadano para obtener la vacuna, y siempre es gratis.
Thank you, Dr. Wu. And finally, I want to give you an update on another emergency that's going on, and that is our blood supply. We do have ongoing issues. We need you to give blood. If you are at all possible, please make a donation. Make an appointment to make a donation. Over the Mother's Day weekend, the total inventory is down less than 2 days' supply. The supply of type O, which is used in emergencies, is even more critical at less than a day's supply. You've seen some media coverage over the weekend, and we're asking folks to reach out and make an appointment. The severe blood shortage is forcing the South Texas Blood and Tissue Center to work with local hospitals to evaluate which patients will receive blood transfusions. In a shortage, patients who need blood to help manage ongoing conditions must wait to receive transfusions, so blood is available for trauma cases and emergency surgery. So imagine that, and imagine if that was one of your loved ones or family members. Please help us with that supply. The South Texas Blood and Tissue Center continues its appeal for 200 more donors every single day. That adds up to a need for about 600 donors a day in total. So if you can, please donate by going to southtexasblood.org, or you can call University Hospital at 210-358-2812. Finally, you can get the latest on COVID-19 at covid19.sanantonio.gov or by texting COSA.gov to 55000. You can also find the assistance programs there available, our emergency housing assistance program or our Train for Jobs program, which will get you back into work while you receive a stipend to make ends meet. Again, covid19.sanantonio.gov or call 311. Thank you so much for continuing to do your part and make sure that you and your loved ones go get vaccinated as soon as possible. The judge, myself, Dr. Wu, and Little Joe are available for questions.
Our first question tonight is for Little Joe, and it's asked that you respond in Spanish. What message do you have for the Hispanic community who is hesitant about taking the COVID vaccine?
Well, we know that the language barrier is there for many of our Hispanic families here in San Antonio. But also, we need the younger generation to participate in helping the older generation to get vaccinated, to take them to the destination where the vaccination began. And lo más importante de nuestra gente es que sepan la verdad, The very important thing about people is to know the facts, the truth about la vacuna, the vaccination. So, si tienen oportunidad de tomar la vacuna, háganlo pronto para que protejan sus familias. If you have that opportunity to get vaccinated and help protect your family, I suggest that you do it as soon as possible.
Next question is for Dr. Wu. When will the Pfizer vaccine begin to be administered in San Antonio and Bexar County for children 12 to 15 years of age?
There is one more step besides the FDA approval today that everybody's really excited about. The CDC's Advisory Committee on Immunization Practices also has to review the data, and we like all these levels of review because we know that when we get the vaccine, it will be safe. We already know it's effective. Probably within the next week, let's say, but I can't be more specific than that.
Has the state lowered the number of vaccines that it gives the Alamo Dome or University Hospital on a weekly basis?
We have been asking for fewer. All of the hub sites have been. The state has not lowered the number.
How long are people having to wait if they go to the Alamo Dome or Wonderland Mall without an appointment?
Wonderland Mall is just a few minutes, probably 10, 15, 20 minutes.
Yeah, I would say it really depends on what time of day. People still do like to really come in the morning, and we have busier times then. If you come in the afternoon, it'll probably be faster.
Next question is for Judge Wolf. Could you discuss the contract between Bexar County and the HHS at Freeman Coliseum? Do you expect it to be extended?
No, they have not asked to extend, and it expires at the end of May. So we expect them to be through with the job that they're doing here by the end of May.
How many unaccompanied minors are currently housed at the Freeman, and how many have been released so far?
Well, we had, I think, a high of 2,100 at one point. We're now down to about half of that. We're down to 1,068 young boys. Over 1,087 have been united with a sponsor here in the United States. Another 261 have been transferred out to facilities that are licensed to handle them. And only 16 are in the COVID separate unit today. So they're winding down very quickly and should be out of there by the end of the month.
Dr. Wu, could you elaborate on why Metro Health is asking for fewer vaccines?
We want to not let any of them go to waste. So the national approach that we're seeing rolled out now is more of a focus on pharmacy chains, on physician offices, and all of the states are finding that the hubs are not ordering as much. Nationally, they're finding that the states aren't ordering as much. You know, it's not just here, it's everywhere. So now there's the possibility of vaccine being transferred to local hotspots that want it more.
Let me make something clear, though, in case somebody's wondering. We have longed for the moment where we could say that anybody who wanted a vaccine could get one immediately, and that is the case. It's been the case for several weeks now. So if you want a vaccine, there's one waiting for you, and we're asking folks not to wait. As you heard, we're on the verge of authorizing or having 12 to 15-year-olds eligible to receive the vaccine. So that might create new demand. But if you're waiting to get your vaccine, you're just putting it off, don't wait any longer. Go in and get one immediately. They're open tomorrow. You can walk right in.
Once the state approves guidelines for 12 to 16-year-olds, will the Alamo Dome or University Health return to appointments if demand for this age group is high?
It's possible. We'll see what happens.
Next question from Mayor Nirenberg. Could you give us your reaction to the fatal shooting death of 6-year-old Sarah Perez and discuss what's being done to decrease the amount of deaths and crime-related deaths involving minors?
It's absolutely tragic to lose anyone, especially a young person, to senseless gun violence like that in our community is absolutely tragic. What I will say is that we have been very focused on violence prevention in our community, particularly gun violence prevention. And so the City Council this year authorized a new Department of Violence Prevention that's a collaboration between the Department of Metro Health as well as SAPD, and we are focused on disrupting violence, cycles of violence at the neighborhood level. I want to thank the community organizations that are working to that end, SA Stands, other neighborhood leaders that are working with us to prevent cycles of violence, disrupt violence, cycles of violence, treating violence as a contagion just the same way we would with a virus that takes too many lives.
Unfortunately, there's guns everywhere today. Just about anybody can get their hands on one, and it's going to be easier now with the legislation apparently that will be passed in the Texas legislature that allows people to carry guns without a license. I don't understand it. We've sponsored a number of programs, gun safety, with a team of volunteers, and we've offered to keep guns in the sheriff's office or to take guns if they want to get rid of them. They're very, very dangerous to have around. I don't know. We have thousands of accidental killings every year, and not in addition to those that do it on purpose. I don't understand it, but we are a gun nut state.
At any point, has Metro Health had to dispose of unused doses of the vaccine in this new phase of walk-up appointments?
No, and I should clarify, if there's huge demand and we have to have appointments some of the time, I would anticipate there's still always going to be at a time of day when people can walk up still at this point in the pandemic. So we at no point have we had to just waste vaccine. We've been very good shepherds of it. We are always watching how many people are driving up at the end of the day, for example, and then opening up just the right number of vials.
That's all the questions we have tonight. Thank you.